India is shining in the glory of its 67 years of independence. We are a great nation with even greater aspirations to be the most favored democracy in the world. We are doing tremendous economical, social, and infrastructural growth. But are we a disease-free, healthy India? A disease-free, healthy India remains a distant dream, and many more milestones need to be covered in our endeavors to be a healthy nation. India is battling with a dual burden of communicable and non-communicable diseases, and also cardiac disease and cancer, which are the major causes of increased rate of mortality, and has made us the disease capital of the world in many areas. Healthcare in India is progressing, but there is still a large section of the Indian population that doesn't have access or quality healthcare facilities. Our focus on prevention and wellness is limited, with a highly unorganized primary care setup. Further adding to the situation is an inadequate healthcare delivery infrastructure, a shortage of talent, and limited funding from public and private sources.
We need to invest a lot more time and effort on our talent capabilities. We are dwindling today from a quantity perspective of talent as also from a quality perspective. And that is taking a toll on the sector, and therefore eventually will lead to price rise, which we must avoid. Having focus on talent is one piece. Infrastructure build out is an area that is really a necessity for India per se and for the sector, because there's not enough healthcare infrastructure available in this country.
With an eye on empowering the healthcare sector in India, a unique collaboration of leading healthcare service providers and other stakeholders came together to create Nathealth, Healthcare Federation of India, an inclusive institution, a forum to facilitate the growth and progress of India's healthcare sector for the benefit of the people of our great country.
The uniqueness of Nathealth is that it is the first truly inclusive and multi-stakeholder healthcare institution of the country. We have got on board today hospitals of all kinds, the corporate hospitals, the big and medium-sized hospitals, nursing homes. We have some of the biggest associations of nursing homes and small hospitals around the country on board. We have got some of the leading medical technology companies, both devices and equipment, diagnostic services, medical healthcare communicators, medical and healthcare education companies. So Nathealth is truly shaping up as a multi-stakeholder organization, inclusive because all kinds of organizations of all sizes are coming on board. That's why it's inclusive.
Nathealth is a big, idealistic organization which has this huge component of the entire spectrum of health energies to meet 21st century challenges, and I believe we are moving in the right direction.
Nathealth was formally launched on 23rd of October 2013. The launch also witnessed the release of the white paper on enabling access to long-term finance for healthcare in India by Nathealth in association with PwC. On the same day, the first annual general meeting was also held.
If you look at the composition of the team in Nathealth, we started with 16 governing council members. We have expanded a lot. When we say expanded a lot, it's not only about quantity, but also the quality of members. Not only we have the best and the topmost healthcare providers in the private sector in terms of size and scale, we also do have smaller hospitals. We also do have a lot many nursing homes.
Nathealth's credibility is fast gaining traction amongst the country's healthcare ecosystem. Its current membership rightfully represents the wide variety of stakeholders that comprise India's healthcare ecosystem. Significant progress has been made in the past 2 years.
Since inception of Nathealth, we have covered Pan-India to achieve the goal of universal access to quality healthcare.
We have had various governing council meetings, first annual general meeting, all members, special general body and leadership meetings with very engaging and meaningful deliberations.
It has looked at Vision 2020. Along with Bain and Company, we have produced a paper which I believe clearly defines how India can benefit from healthcare provision, which is involving the government, private players, and so on.
The Bain & Company has had the privilege of working closely with Nathealth right from the inception of the powerful concept of Nathealth. We have been working as a knowledge partner and working closely with the governing council, with the key members to help define the vision mission statement, to define the governance model, and to help recruit the right stakeholders for Nathealth.
NASSCOM and Nathealth have signed an MOU at NILF, NASSCOM India Leadership Forum, to explore IT's transformational potential in healthcare.
The idea of Nathealth and NASSCOM coming together is to leverage these technology trends and this capability that exists in the industry, along with the innovation capability which has now been created, to enhance the quality and reach of healthcare in India for the people of the country.
We thank the Nathealth Governing Council for giving NASSCOM and our industry members the opportunity to partner on a joint charter and make our collective efforts impactful for India's citizens.
Some of the key highlights of the MOU are partnership to focus on leveraging technology for improving patient care, address challenges in healthcare that can be significantly impacted through use of technology, build linkages between various stakeholders in the healthcare services ecosystem and technology industry, jointly identify and evangelize new class of technology solutions and service delivery platforms, enhancing access and affordability.
There are two factors that the patient really cares about. One is access to healthcare, and where does that patient access healthcare and at what cost and with what convenience and so on. What proximity, what convenience, what cost. And then the quality of healthcare. So what are the effective outcomes that the Indian healthcare practice is able to achieve for the customer?
Considering detailed input from our members, Nathealth had submitted its first budget proposal to the government. Some key points are: accord priority sector status to healthcare, effect reforms in medical education, mandate and recognize quality accreditation, enhance healthcare insurance, provide impetus to manufacturing, rationalize customs duty, encourage cross-sectoral collaboration, leapfrog through innovations, integrate Indian sciences, accord priority to preventive healthcare. With 27 of global and India's leading medical technology companies joining Nathealth, we at Nathealth created the MedTech Forum. Nathealth had proposed to set up a committee that will work with relevant government and private agencies and lead the creation of a framework that regulates and allows cadaveric organ transplant to meet the huge requirements in our country. Nathealth is looking forward to setting up a code of conduct and an ethics module and take it national.
It's a matter of grave concern to me when I hear about the so-called trust deficit. As doctors and people working in the healthcare industry, we should first make our own code of conduct. This would include things like being frank and truthful to the patient. Secondly, give him a clear idea about what the charges are going to be and ensure that the patient or the client is not unnecessarily subjected to wasteful investigations or a prolonged stay in the hospital. Nathealth is shortly coming out with a model code of ethics, which we as an organization shall adopt and then share with the rest of our country. If we can achieve this, we shall go a large way in getting rid of this so-called trust deficit.
With the vision to be the credible and unified voice in improving access and quality of healthcare, Nathealth is committed to work on its mission to enable the environment to fund long-term growth, help develop and optimize healthcare infrastructure, help shape policy and regulation, help bridge the skill and capacity gap, encourage innovation, support best practices and promote accreditation.
The journey of last 1 year has been very challenging but very interesting. And the most interesting thing out of all this is the collaborative spirit that Nathealth has been able to create. But all I will say in the end is, in the language of the British poet, we have miles to go before we sleep. We have miles to go before we sleep. A lot of work to be done.
Nathealth will look to collaborate with the government to provide expertise and support as we move towards a healthier Arogya India, where citizens are health aware and engaged and have equitable access to affordable health cover with a focus on prevention, early diagnosis offered by a vibrant ecosystem of public and private players operating in a sustainable healthcare system. Nathealth, Arogya Bharat, Anmol Bharat.